You're watching the latest edition of the Wellness Hour. I'm Randy Alvarez. Today's topic is TMJ, or also known as temporal mandibular dysfunction, TMD. If you have neck pain, chronic headaches, migraines, facial pain, earaches, and even dizziness can be caused by this problem. Over 40 million Americans are suffering with TMJ, and most don't even know it. My first guest is an expert in the diagnosis and treatment of this disorder. If you have any of those symptoms, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of the Wellness Hour. I'm Randy Alvarez. My first guest is Dr. Leonard Feld. Dr. Feld has been in practice for over 25 years. He has a multi-specialty dental practice. His focus is getting people out of pain that are suffering with TMJ. Dr. Feld is multi-credentialed in endodontics, implant dentistry, and TMJ. He's an associate part-time professor at USC. He's here today to talk about his passion for helping people that are suffering from pain associated with TMJ. Dr. Feld, welcome to the show.
Thank you.
Now, before we get into today's topic, which is TMJ, that can cause, I guess, headaches and dizziness and all of these other things, tell us about your background and training.
Well, I went to school at the University of Southern California School of Dentistry and practiced for a while there, and I did specialty training in endodontics and oral surgery, and basically was just practicing. Then because of my passion to help people, I got involved in working with other specialists in the field of dentistry and working in specializing in endodontics and oral surgery.
Now, what is endodontics, by the way?
Endodontics are root canals.
Okay, so that became your specialty, and then you moved into dental implants, according to my notes. Mm-hmm. So how did you get from dental implants to focusing on TMJ?
Well, we found that a lot of times the problem with the root canals and helping the people trying to save teeth, they weren't unsavable. And implants were around, and in 1986, I got involved in implants in order to supplement the loss of the teeth as an option for the patient.
Okay.
And to replace the missing tooth. So I was involved in that for quite a while. And as I did more in implantology and did more and more implants, I found that I needed more schooling, and I went back to school and did a couple residencies in implantology. And along with that came reconstruction, full mouth reconstruction, and as we got involved more and more reconstruction, I just seemed to get involved with people that were in pain. And it wasn't from the dentistry, it was from that they had pain. And with implants, the need for occlusion, for the teeth coming together properly is critical. Because implants are stronger than teeth in natural chewing, but they don't take lateral forces very well. So along came occlusion, where the teeth come together properly, and I ran into then this dysfunction and the problem with teeth not meeting together and problems, and all these people had pain. And so I said, wait a minute, we have another problem here. And it wasn't the teeth, but it was associated with the teeth.
So the bite was off, giving them what kind of pain? You're saying pain. I mean, localized pain or pain, headaches?
No, they were having headaches, they were having migraines, they were having back pains, neck pain, earaches, dizziness. People were having tingling in their fingers, insomnia, they couldn't sleep. And it was all associated with this joint here.
So you kind of put two and two together. You started seeing the connection.
God, I did, but I didn't, because I don't know, it took me a while to really put it together. I didn't have all the pieces. And then when I went back to school again, I started finding out that this was the problem. So I can't take credit for figuring it out, because I don't know if I was that smart at the time.
Okay.
But after a while of seeing all the problems that was being created, and these people having all these challenges with headaches and the teeth not coming together properly and the balance not being there, and it was scary, because they thought that's the way they had to live. And that's how I kind of evolved in it. And
I mean,
all
you
of a
see
sudden-
people getting better all the time. Because I want to go into the specifics of what it is, what causes it, but you see people getting better. Let's start there. I mean, really.
Absolutely.
You smirk when I ask you that.
You sound skeptical.
Okay. Well, I am. I'm here asking the questions.
Well, I
but
understand that.
I'm curious.
But
do you see people getting out of pain?
Yes, it is
Every day?
every day, every day. Every day I have a patient come in that's either referred or sent to me because whoever's been working with them can't help them anymore. And so I'm kind of like the last resort, I guess.
Then let's start with the symptoms. We've talked to the phone, and you're saying that the TMJ may not just be pain right here in the jaw, that it could be manifesting elsewhere. What do you mean?
Well, that's where it starts.
Okay.
Okay, it starts because misalignment of this joint. It starts with the tiredness of the muscles, and that gives off to headaches, dizziness, earaches, tingling of the hands, backaches, insomnia.
So people with earaches, they could have TMJ.
Yes, sir.
People with
Absolutely.
chronic headaches, it could be related to TMJ.
All the time.
What's the science behind this? I mean, do you have proof of this?
We have probably 70,000 articles about this.
Okay. So then what is TMJ? Why don't you explain it to us? You brought a model. Why don't we start there?
The skull here is a representation of the area that you've been pointing to on your head. This is, and let me explain what TMJ is.
Okay.
Okay. This is the temporalis. This is a muscle and it's a bone. Okay. And so this is, for all intents and purposes, the temporalis or the temporal. Mm-hmm. This is a mandibular jaw,
Right.
which is mandibular.
Mandibular.
And where they go together is the joint. Okay? So this
The joint is that.
area here
Okay, got
where
it.
they meet.
Okay.
Okay? What's unique about this, more than any other part of the body, is we have two of them.
Mm-hmm.
So that when one is out of a line, the other one is out of a line.
It's affected.
Correct. Very good. Good.
Thanks.
Yeah. And it's, something, it's as simple as that, is that if it's out of a line, the other half's out of a line. And that's where people get postural problems, and that's why they get earaches. Because when this is out of a line, you notice right here, there's a hole here. Mm-hmm. That hole is the ear. And you can see the proximity, how close this joint or jaw is to the ear. And so when this is out of a line or puts pressure on this bone here, you're putting pressure on the ear. And that's where the pain comes from.
Okay, so this TMJ, the joint, it gets inflamed, it hits nerves. What does it do? I mean, because I'm not clear exactly how it could affect, obviously it's close to the ear, but how could it affect neck pain or dizziness, chronic headaches, migraines?
Right. First of all, we understand that all the muscles are tied together.
Okay.
Okay? So this muscle here is tied to this muscle is tied to this muscle. So as they get tired from constantly moving and constantly being overactivated, they get tired. The fact that this joint here, this bone, mm-hmm. is in this area here, there's a disc that sits on top of this joint here. And when that disc gets displaced due to either a trauma, a micro trauma or a macro trauma, anything from a rear end car collision to being hit to falling down, and this disc gets loosened, or the fact that someone's grinding at night because their bite isn't right and they're trying to get it back into some sort of alignment, that puts the stress on this joint. It also puts the joint further back.
Okay.
And as it puts it further back, it stresses the tissue behind the joint, which pushes on the ear. And this becomes inflamed. No different than if you got hit in the shoulder by someone. And the challenge here is if you got hit in the shoulder or you had a broken arm or something happened to the muscles, you could rest it.
Get a sling.
A sling. You could put it in ice, you could take some medication, and it would heal. But with the jaw, you're moving 2,000 times a day, it never gets a chance to heal.
Okay, so you have to talk all the time. And
you talk, you chew, you
constantly being irritated.
Absolutely. So
Interesting.
the fact that it's tired already, it never gets a chance to rest.
Do you think it's being missed then? I mean, because people they get a whiplash. They see a chiropractor, they see a pain specialist. I mean, is this a new area of study or focus, the fact that it could be this TMJ joint that's causing all of these other problems?
Well, Randy, we run into this all the time, and I'm usually the last person they see. And that's really a good question for someone that's not on the scope of all this thing. But if you think about it, most people, if they have a headache, who do they go see? They go see their physician. If they have an earache, they're going to go to ENT or ear doctor. Mm-hmm. If they're dizzy, they're going to go to someone that works on the ear because that's a central part of dizziness. If they have neck aches, if they have back aches, upper shoulder, they'll see a physical therapist or a chiropractor, anything to put them back in balance. And usually that does work for a while. But the main source and the problem that's creating it is still there, so it's not alleviated.
Okay, so you're saying, we're going to take a quick break, but you're saying the people that possibly have failed elsewhere, they've tried conventional therapies, maybe not so conventional therapies, but they have chronic headaches, ear pain, neck pain. It may be right here that may be causing it.
You got it.
Or TMJ.
That's
okay.
it.
Okay. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Feld, who specializes in TMJ, getting you out of pain. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about TMJ with Dr. Feld. Now, Dr. Feld, how many people suffer from TMJ? I mean, you say a lot of people.
Yeah, it's estimated now that over 40 million people have this disease.
Now, this is not a recognized dental specialty.
Well, it's a specialty within dentistry, and it's becoming more and more recognized in that there's an actual problem.
So there are groups, there are associations, you guys get together.
Yeah, the American Academy of Craniofacial Pain, the American Academy of Pain.
You're members of these academies.
American Academy of Orofacial Pain. These are large societies, yes.
Okay, and what
hundreds and thousands of dentists that belong to this.
What does a patient has TMJ? Because not all dentists, everybody has their specialty. How does a dentist find, or what should they look for in a dentist that is going to be handling their TMJ problem?
What a great question. All they really have to do is when they call up their dentist, find out whether they've been trained in TMJ, if they know TMJ, have they done it, have they worked with patients, how many have they worked with, how often, are they credentialed in any way? I mean, these are questions that people should ask. They ask that about their physician, about their cardiologist, about their a physician or plastic surgeon. Have they done plastic surgery? How many have they done? It's a simple question and it's a simple answer. But there are many, many people that are involved in this.
Take me through the process. Somebody goes in, they say, okay, I'm going to see Dr. Feld. How long does it take for you? Take me through the diagnostic process.
Well, the diagnostic problem of the problem is usually questions and answers to begin with. We talk to the patient about what their challenges are, where they're related, and let me show you something.
Okay.
Let me show you something. This research was published in 1986 by Janet Travell. Take a look at this. You see this here? These are the teeth.
Yeah.
These are trigger points for this muscle here, and it's attached. It's attached with the skull where I showed you how it was all attached, it creating pain and creating a headache. It creates these problems here. You see here, these red spots, these are all created by muscles.
Earache,
pain,
neck pain.
Pain over the eyes, neck pain. These are all created by these tired muscles, okay? And these tired muscles are all connected to the teeth and the jaw.
Okay, but there are things you can do. Now let's move on to treatment. What can you do as a dentist then to relieve this pain?
Well, what we do is we've recognized the fact that the muscles are tired. They're tired because of the position they're in. They're tired because of where they're at.
You say tired though. I mean, what do you mean tired muscles? And how could they cause pain?
The muscles get tired from being overused. You run a lot, you get tired. Okay. The muscles are overused because of all the interferences, the jaw is not balanced, and because it's not balanced, they get tired. And they don't get a chance to rest because we move our jaw open and close it at least 2,000 times a day, including eating. Someone like you that probably talks a lot, probably uses it even more. So I hope you don't have a problem.
Maybe 3,000 times a day. Open and close.
I didn't say that.
Okay.
They get tired because they're overused. The head, for instance, the head weighs 15, 18 pounds. You might be 18, I'm 15.
Okay, good.
And it's balanced on a pole. Something like, as an example I use all the time, is a baseball on top of a pencil.
Got it.
Okay? And the baseball is tied to the pencil by rubber bands.
Got it.
Okay? And so now the rubber bands get stretched because the baseball is off to one side. Mm-hmm. Okay? And this is a large stress on these bands. The other bands, or the other rubber bands on the other side, are now loose.
They're loose.
Flaccid. And the other side is overstretched.
So one side is tight and one side is loose.
Right.
Got
so
it.
this is always going on because of either interferences, the jaw being in the wrong place, and this dysfunction that's in this joint. And by being tired, they get overused. They don't get a chance to rest, especially in your case.
Okay.
They don't get a chance to rest, and so consequently, this tiredness is a constant ache. They don't get to go to bed at night and rest, because even when they're in bed, they're swallowing. Mm-hmm. They're still using their jaw.
Okay, so this imbalance in somebody's mouth, maybe caused from an accident, some kind of trauma, it gets misaligned. And one side is tight and one side is loose, or one band may be loose. So, and it can trigger pain to headache.
It's like a teeter-totter. Do you remember when you were a kid and you were a teeter-totter? You never wanted to play that game with someone that was heavy because you'd be up in the air all the time?
Right.
One side affects the other side.
So this is a simple thing then. So how do you create balance then?
What we do is really simple. It's kind of scary.
Okay.
But what we do is we relax the muscles with certain machines.
Okay.
And when the jaw is relaxed, we take impressions of the jaw at that particular point. And then we make a little appliance that fits on the teeth for the patient to be on a physiological rest position so that the jaw now can rest.
And
that's it.
Okay. Is there art to this? All science? Art and science?
It's all.
How much is your skill involved?
I'd say my skill probably 20% and 80% science.
Is that right?
Yeah.
So you have to balance the mouth,
right?
Balance the bite, and the pain goes away.
And the pain goes away.
What have you seen? Give me an example. Okay, so somebody comes in, headaches, chronic headaches. Give me one example of somebody that all of a sudden you fix their bite and their pain's gone. You've seen that? You've heard that?
Every patient. It's amazing. I have patients that come in for one thing, and we see their bite off, and we ask them if they have headaches. They say yes. Is that a concern of yours? Yes. How often do you have migraines? 2-3 times a week. They don't have a job anymore because last year 600 million days of work were lost because of headaches.
Okay, what about a dentist watching this, saying, well, this is not my specialty, general dentist, and they're saying, oh, Dr. Feld might be overstating the truth as far as the benefits of this working. What do you say to that dentist?
The research is in. It's all done. We know this is a fact.
So it really works?
There's no question. We know it works. We can help the patient without surgery. We can help the patient without any trauma. It's a simple procedure.
Why aren't all dentists doing this then?
Well,
let me ask you that. I mean, if it's such an effective treatment, why aren't they all doing it?
Well, first of all, it takes more study to recognize it, what to do with it, how to diagnose it, how to read an X-ray, and not all dentists want to do that. We're in an age of specialization now. Okay, so we have people that do root canals, we have people that do bridges, we have people that do gums, we have all these different specialties, and someone that's in that is not really overflowing into another field. And that's why we developed a multi-specialty practice, and having all the specialties within one practice so one could work with another one.
Okay, tell me this then. Anticipating this interview, spoke to some people, and they said the only way that they could be doing this is these full mouth reconstructions, sanding down all the teeth to create balance in the bite, and it's very dangerous. You're saying that's not the case. That's not what you're doing. That's not your approach.
Not necessarily. It could be, but that's not necessarily the fact. The fact is, what we normally do is we get them in balance to see where they need to be. And it could be orthodontics. It could be moving the teeth into the right place. It could be just maybe a couple spots that are interfering, creating this interference of getting the jaw out of alignment. I mean, and when you really think about it, it's not a big deal. But it is when you walk around all your life with a headache. Have you ever had a migraine?
No, I have not.
Okay. It's debilitating. People don't go to work. They're in pain. They crawl up in a fetal position. They turn the lights up. They see spots. The pain is so great they take their fingers and try and poke their eyes out.
So is there a test? I mean, somebody at home that has these migraines, that you could give them a tip to self-diagnose in a way that they have, this root cause is TMJ.
If their jaw is misaligned, that usually will cause, not all the time.
They can open their mouth, close their mouth? I mean,
sometimes
what do they do?
They can't open all the way. Sometimes they have trouble swallowing. Sometimes they have pain or the teeth are loose. Sometimes if food gets caught between their teeth, that's a sign that the teeth are moving, trying to adapt to a malfunction. These are signs, symptoms like teeth wearing out, where we call them facets, where you can look in the shiny parts of their teeth now because they're grinding their teeth and they don't match right. Is this what you're after?
Yes, yes.
Okay. They could try a physical test. They could stand up and look, straight up and down, put their arm out straight in a perpendicular fashion, and have someone push down on their arm. Okay?
Right, okay.
And then see how strong they are in resisting that force. They could take a couple cotton rolls or a couple gauzes and try and open their bite by placing them in the mouth, okay? And bite down and say the same thing. And if they get stronger by just having that in their mouth, it's probably over 90%. Yep.
Is that right? Okay, we're going to take a quick break. One of the things you said to me on the phone, and I'm going to bring up right now, is you said, I said, what? You were doing dental implants, then you moved into TMJ. I said, why? And your first response was, you could finally do something that can really impact people's lives, make them better. You meant that.
Yeah. I really got excited by the fact, I've had some patients that I've changed their life. I mean, not that I can't with implants, because we make people pretty, we get them to chew, we put them back in mastication.
Get rid of their dentures.
Get rid of their dentures. They don't have to have dentures flopping around in their mouth anymore or falling out. I mean, I have a story of an elderly woman. She had 23 grandchildren, and I'll get tears in my eyes here, but she did not go to one family function, would not eat with her grandchildren because she had the fear that her teeth would fall out while eating. And she really had no jaw left. There wasn't much there. And she came to me as a last result, referred by another patient. And we put a couple implants in there just like adhesive, just to hold the
like
teeth in.
A fixed denture.
Just a fixed dent to keep it from falling out. And she came to me about 6 months after we had done it. And because we called her in because we wanted to make sure everything was okay. And she says, Dr. Feld, if I'd have won the lotto and won $23 million for my 23 grandkids and been able to give $1 million to each one of my kids, it wouldn't have made me as happy as you've made me with my implants, because now I can have Christmas dinner with my grandchildren.
So this is what drives you? Now, there's been a shift in your practice?
Yeah, major shift, because originally it was, that's part of the deal, part of the package.
TMJ, by the way, is one of those things? Because what I hear you say, it almost sounds overstated. But you're saying that these people really get better.
The people involved in this, again, you sound skeptical. I almost wish you had it so I could help you.
Is that right?
Yeah, because it's so dramatic.
And predictable.
90%.
Okay, we're going to take a quick break. We come back, more about TMJ. The symptoms as a recap, who's a candidate, and how fast their pain can go away. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Feld. We're talking about TMJ. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about TMJ with Dr. Feld. Now, Dr. Feld, give us a recap. Symptoms. We're just about out of time. Well, somebody, how do they know if they have TMJ?
If they have cracking, grinding, they have insomnia, they have trouble sleeping at night, earaches, possibly dizziness, tingling in their fingers, problems swallowing, food getting caught between their teeth, which is a shifting of their teeth, trying to adapt to a malfunction of their jaw bite, neck aches, simple little neck aches, back aches, shoulder, back in the scapula, in the back of their back, headaches, migraines. That's a big one.
How long does the treatment take? A month? 3 visits? What is it?
Well, we start right away. We get them out of pain immediately.
You say immediately they're out of pain. After the first visit?
They know they're out of pain. They know after the first visit, they know they're out of pain.
Is that right?
Yeah.
Okay.
They know they're out of pain. We have the patient comes in, we do the measurements, we make the appliance, and actually the treatment relaxes the patient, so they just know they're out of pain.
So
they feel
needles,
better.
there's no...
It's atraumatic. There's no needles, there's no knives, there's no nothing.
You use the expression, they know they're out of pain. Are you saying they're out of pain?
They feel better immediately, literally.
Is that right?
They're, in fact, during the treatment when we're first starting, half of them fall asleep.
Is that right?
Yeah, they feel so good. And some of them tell me they haven't felt that good in a long time, or they felt like they've slept all night, and it's only 45 minutes.
Okay. Well, and this may sound like I'm siding with you here or cliche, but I mean, is this the most rewarding part of dentistry, in your view, in your opinion?
You know, I don't know how to say it and not sound corny.
Okay.
But it's really great. It's really terrific because, I mean, you should see the cards and letters I get, and I probably should have brought a stack of them, but the people are so excited that they don't have any pain anymore. It changes their whole life. I mean, my staff, even my staff at the beginning, when we sent them to school and we sent them to training. Well, before I sent my staff, I was doing it, and they were so skeptical. They couldn't believe it. They thought I was using some sort of whiskey potion or something.
Is that right?
Yeah.
Really? Even the staff, they were surprised.
Absolutely. They couldn't believe it. And then I sent them to school, and they've all been trained, and, you know, I've got such a great staff. They're just fabulous.
Everyone says they have a great staff.
No, I can't live without them. Really? I can't live without them. I just, they're fabulous. They're just really great. I think the reason they were so skeptical is they really care about the patients.
So the TMJ, main message, final message you want people to know about TMJ. What do you want them to know?
That if they're having any of these pains, the neck pain, the back pain, the earaches, if it's related to the TMJ, and that's the cause, and usually 9 out of 10 times it is, that it can be taken care of.
Dr. Feld, I want to thank you for coming on the show. Very interesting.
Thank you for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information on future airings of this segment or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.